Good afternoon, everyone. Thank you for joining our live Medicaid Matters telephone town hall. The purpose of this event is to discuss your concerns with Medicaid and how Congressman Jim Costa is working on behalf of the San Joaquin Valley to protect this critical program for decades to come. This is an interactive forum, and we would love to hear from you. We will do our best to answer as many questions as possible this afternoon. And without further ado, Congressman Jim Costa, the floor is yours.
Well, thank you very much, Anthony, and I want to thank those constituents in the 21st Congressional District, which I have the honor and the privilege to represent you in our nation's capital, for participating in this afternoon's telephone town hall on Medicaid Matters. Now, I understand that all of you are interested in many issues affecting our country and issues that impact your pocketbook, inflation, the cost of housing, the cost of groceries, and the recent impacts of these tariffs as it relates to our nation's economy and the impacts of investments of our retirement and the 401ks. All of those are very important issues that I want to continue to have a conversation with you as decisions are being made here in our nation's capital. But this week, we are voting tomorrow on a reconciliation package that focuses in large part on the cuts that may be occurring, I believe will be occurring, as it relates to Medicaid. And why Medicaid? Well, this is the part of the reconciliation process in which Republicans are moving forward so that they can have sufficient range to extend the tax cuts for the richest people in America. And I think it's really a question of priorities. And the way our budget process works, we will be voting tomorrow on Medicaid funding. It's, in my view, a lifeline. It's part of America's safety net. From birth to the end of life and everywhere in between, Medicaid in America saves lives. All 50 states and the District of Columbia participate in Medicaid, and individual states provide additional funding. Therefore, Medicaid is a partnership between the federal government and each state. For many of you here in the 21st District, you may know it as Medi-Cal. Let me just say, Medicaid is Medi-Cal. Let me repeat myself one more time, because I want to assure that there's no confusion here. Medicaid in California is Medi-Cal. And so if you're one of the many millions of Californians that receive Medi-Cal, you're receiving your funding in large part by federal dollars that comes from Medicaid. Republicans in Congress are trying to write a budget without the participation with Democrats engaged in the usual compromise that is part of our budget process. And President Trump is leading the charge, I think, in trying to undermine so much of what is critical in our safety net. In the first 100 days, President Trump has proposed a budget that guts Medicaid, not to improve health care or save lives, but to pay for making these tax cuts permanent for the biggest corporations in America and billionaires. The Republican budget plan, Congressional Resolution 14, instructs the House Energy Committee and Commerce to cut $880 billion. That's a lot of money, any way you slice or dice it. But here's the catch. Energy and Commerce only oversees $135 billion in spending that isn't part of Medicare or Medicaid. So if $135 billion is above and beyond what they spend in Medicare and Medicaid, and they're required to cut $880 billion, guess where the overwhelming majority of those cuts are going to come from? You guessed it, Medicaid. And therefore, $880 to cut $880 billion without touching the Medicare funding that the federal government provides to state, there's going to have to be hundreds of billions of dollars of cuts from Medicaid. This would result in the biggest Medicaid cut in the history of our country. Remember, Medicaid, when introduced in the 1960s, was part of a safety net for Americans. A nonpartisan Congressional Budget Office, SCORE, did an analysis that confirms that the Republican budget can only be enacted with significant cuts to Medicaid. That's the bottom line. Now let me make it local, because you live in Fresno County, Tulare County, live in the city of Fresno, Selma, Sanger, Dinuba, Visalia, wherever, you're in the 21st Congressional District. In almost 800,000 people that live in the Congressional District that I have the privilege to represent, you should note that 456,532 people are covered by Medicaid. This Congressional District that you live in, that I represent, has the highest Medicaid recipient population, third highest Medicaid recipient population of all the congressional districts in America. To give you a bigger picture, over 1.8 million people in the San Joaquin Valley, which goes beyond my congressional district, the four other congressional districts that include Adam Gray, David Valadao, Vincent Fong, and Tom McClintock. The five of our congressional districts add up to about 1.8 million people in the San Joaquin Valley that depend on Medicaid. That is more people than the entire state of West Virginia. So let me be clear. On the early part of this budget process, I voted no, as did all of my Democratic colleagues. And tomorrow I will vote no again because of the impacts of the cuts on Medicaid. The bottom line is, in my view, you can't claim to care about rural America, which I represent a lot of, families, children, the elderly, our public health, while voting to take away health care from those who most need it. But let me go further to explain. Medicaid keeps our rural hospitals open. It helps children with disabilities get care. It provides long-term support for seniors. It allows people to see a doctor before an illness becomes a crisis. And in places in the San Joaquin Valley, for so many of the people that I represent, over 450,000, it's the difference between life and death for so many countless families. Stripping Medicaid, from my perspective, is not fiscal responsibility. When you take health care away from those who can least afford it, it's cruelty. And I'm going to continue to fight back. So we're going to have, and in the process of putting together a process for future town halls, and we want to do them in person, but to make sure everybody can participate on all of these issues, as I said on the outset, from the cost of living to the impacts of inflation to the cost of the impacts that these tariffs are having on our economy and the cuts in the federal workforce. But today we're going to focus on Medicaid because, as I've just tried to establish, Medicaid matters to over half the population of my congressional district. So without further ado, I look forward to taking questions you have. And let me be clear, if you have questions that I can't give you the answer, we will follow up. We'll take your name and phone number, and we'll get back to you here with an answer for the question that you've asked. But just to put a final coda on my comments, Medicaid enrollment in California covers 43% of all the children in California, 40% of moms giving birth and their newborn babies, 48% of working age adults who have disabilities, 61% of people living in nursing homes, 25% of Medicare beneficiaries who are dually enrolled. Some people are dually enrolled both in Medicare and in Medicaid or Medi-Cal. 22%, almost 23% of the adults ages 19 to 64 are benefited by Medicaid enrollment. So the federal funding for Medicaid to California was in 2023 $90 billion, 64% of all the federal funding to California. So this is a big deal, and look forward to taking any questions or comments you may have. Thank you very much.
Thank you, Congressman. Callers, as you all know, this is an interactive forum, and we would love to hear your questions about Medicaid. Now we will be beginning the question and answer portion. To help keep the conversation focused and informative for everyone, we kindly ask that questions stay on topic of Medicaid. If you have any questions, you can press *3 on your keypad at this time. Once again, you can press *3 on your keypad at this time to ask a question. A member of our staff will collect your questions, and we will answer as many as we can during the live event. Additionally, we will also be having 2 additional features available. If you would like to subscribe to our newsletter, you can press *6. Once again, if you would like to subscribe to our newsletter, you can press *6. Finally, our dedicated team is here to help you with any Medicaid questions or issues that you may have. So if you would like to speak to a staff member about any specific help with a Medicaid case, you can please press *0 on your keypad at this moment. Once again, if you would like to seek help from our caseworkers, you can press *0 at this time. Again, if you have any questions throughout the event, please press *3 on your keypad at this time. Congressman, we will go ahead and take our first question. Our first question is from Tamara from Exeter, California.
Hi,
hello,
how are you today?
Tamara,
Hi.
the floor is yours.
Hi, how are you?
I'm good. How are you, Tamara? Is it
I'm
Tamara?
good. It is Tamara.
Thank you, Tamara.
So my question was, I have an adult developmentally disabled daughter, and she's covered by my private health insurance, but she is also on Medicaid. How do you think that if there are big cuts to Medicaid, it's going to affect people with developmental disabilities and people who are receiving services through in-home support services?
Well, it ultimately will depend upon how big the cuts are, but I'm very concerned, and let me tell you why. I have been a supporter of in-home supportive services throughout the years I've been here in Congress, and even when I was in the state legislature. In-home supportive services give you more flexibility to provide care for your loved one, and it's a challenge that only you know. And in-home supportive services to California with Medi-Cal covers those services to people with disabilities, blind, or any other Medicaid programs. And depending upon the level of the cuts, it could be significant, which is why I'm opposing this measure, because it provides you flexibility that you otherwise would not have, given the nature of your loved one's disability. So I would ask you to continue to stay with us on this effort, and as the proposed cuts are being made in this budget process tomorrow and in the ensuing next month, 2 months, we will be able to better tell you to what degree this may impact the benefit you receive from in-home supportive services. I wish I could be more specific, Tamara, but until these cuts are actually made, it's not. We're not able to give you the level of degree of the specific nature of the reduction of care.
Right. And I know I just wanted, I guess to talk to you.
Well, I appreciate you highlighting this.
Thank you, Tamara. We will move on to our next question. Congressman, our next question comes from Monica of Fresno.
Hello?
Monica?
Hi, Monica.
The floor is yours.
Hi, Congressman. What, as a private citizen, as a taxpayer, what can we do to help you get this? I mean, you're only one vote, but there has to be something we can do to help with this.
Well, there is, and you're participating this afternoon in this telephone town hall is helpful because you're expressing to me your concerns about these indiscriminate cuts, and it's really a value system at the end of the day. What is more important, providing a safety net of health care to all Americans, or to providing these extended tax benefits for the wealthiest in our society. And my values is that every American ought to have access to affordable health care. And that's why I voted for the Affordable Health Care Act in 2010. There are gatherings that are taking place around this country where people are coming together to make their voices heard. We had such a gathering in Fresno on Saturday. There's going to be more opportunities for people like yourself to weigh in, and but we've got to make our voices heard. And I think we're beginning to see that Americans certainly want to eliminate inefficiencies and waste in government, but going to the essential services that, like Tamara explained a moment ago, with her call-in with a family member, an adult family member who she cares for, that relies in part on in-home supportive services, that's a necessity. That's not a luxury. And these are the kinds of safety net health care that we need to protect. And so continue to be involved, to be engaged in multiple gatherings to make sure that your voice is heard. And your call today inspires me.
Thank you very much, Monica. Congressman, our next question comes from Fua Yang of Fresno. We are bringing them live on the call. Fua, the floor is yours.
Hi, Congressman. My question was answered, but I don't have Medicaid or Medicare, but I am concerned about the congestion at ER. I worry about that. If there is cut to Medicaid, what will happen with the flood or with the increase of people being at this place? I mean, is a hospital ready for some type of, influx of people coming in?
Well, I'm glad you raised that question because these are the alternatives that are a critical factor. Preventive health care is the most cost-effective kind of health care that we can provide. It's the old line that, our parents used to say, an ounce of prevention is worth a pound of cure. And so when we have Americans being able to deal with an illness early on before it becomes more serious, it makes a difference. And if the individual, because they don't have access to the care, their condition grows worse, then, as you pointed out, they can end up in the emergency room in any one of our hospitals, and that becomes much more costly. And the impacts on Medicaid on patient ratio already is very challenging for our Valley hospitals. Let me give you some numbers. Community Medical Center, 55% of their patient load is reliant on Medicaid. Kauai Hospital, it's 65%. Adventist Hospital in Reedley, it's 67.7%. And Adventist Hospital in Selma is 57.9%. Valley Children's, one of only 5 children hospitals in California, 76%, the highest. And United Health Centers, and of course, as a part of the Affordable Health Care Act in 2010, we greatly expanded federally qualified health care clinics throughout the country. And we've seen that not only in United Health, but Clinica Sierra, Golden Valley, Carmarina, so many of the federally qualified health care clinics that have expanded health care, especially in our rural areas. But we know that 2 years ago, I fought very hard to keep Madera Hospital open. But because of the combination of the reduction in reimbursement rates, Madera Hospital had to close. Now we're trying to reopen it now. But let me just go back to your point. It is well known that there so many people rely, because they don't have earlier care, on the emergency room. It's not unusual to have 100 people or more every day at Community Regional Medical Center who are waiting to be attended to. This is not the best way to provide medical care, nor is it cost efficient. And so if you cut into the safety net of Medicaid, then you're going to eventually have more people, as they become ill, have no alternative but to go to the emergency room. And that's more costly, bottom line. So I'm glad you raised the point, and it's one of the many reasons I'm doing everything I can to keep our current level of funding for Medicaid.
Great. Thank you, Congressman. Our next question comes from Paul of Farmersville.
Yeah, hi, Congressman. I'm glad to hear you. And it's sad that, we're in such a situation where it's unfortunate, unfortunately what's happening there to target low-income people. But my question is 3 parts, and if I could just say it all at once, which is how can hospitals stay open with reduced medical payments? I know you just talked about that. Will counties be tasked to support hospitals, and how can they do that? And if counties can't cover that cost or others can't, and we have hospital closures, is that going to affect not just the poor, but all of us here in the Valley?
Well, it will, because bottom line, and you've made a good description of the challenges we're facing, health care in this country and in our Valley is dependent upon our local health care providers, which include our hospitals, as I noted a moment ago. I gave you the percentage of Medicaid patient ratios and Community Medical Center, 55% plus, Kauai, 65%, Adventist Hospital Reedley, 67%, Adventist at Selma, 57%. I'm repeating these numbers because I think most people don't realize the level of dependence of Medi-Cal reimbursement. Valley Children's, I said, is the highest, one of only 5 children's hospitals, 76%. And then our federally qualified healthcare clinics. Counties are an arm, to your point, of the state of California. So any money that counties that, we used to have a county hospital, you may remember, in Fresno, and that got absorbed by Community Medical Center. And now they provide for the health care that used to be a domain of the Fresno County. And other counties used to have hospitals as well, Tulare County as well, and Kings County. But it got so difficult for counties to try to provide that balance, even with state and federal funding, that just about all the counties in California have gotten out of the hospital business. And so we're really reliant upon our nonprofit hospitals, our clinics, the state of California providing additional funding for the federal government's share of Medicaid. And certainly the scenario that you just described, counties are not going to be in a position to make up the difference. And the state of California, as we all know, is having its own financial problems. California hospitals received $14 billion, it was estimated in 2023, from Medicaid payments, including a separate category of $8.4 billion in Medicaid Disproportionate Share Hospital. The acronym for that is DISH. And there were other payments that help offset uncompensated care for Medicaid patients and the uninsured. But the amount of health care that's being provided by our hospitals and our health care clinics for people who have no insurance is significant. And so it's a great concern for the difficulty our hospitals are facing. Our community health centers served 31 million patients in California in 2023, and 69% of that was covered by Medicaid, and 61%, my friend, of nursing home residents rely on Medicaid as their primary source of coverage. And so that's why I'm so exercised on these potential cuts, which make no sense. And if the scenario that you just described, and I'm taking a little bit long on the answer to your question, were to come true, I think our healthcare crisis that currently exists in not only California but around the country would be tremendously exacerbated, and we would have a healthcare crisis on our hands, and some say we're there already.
Thank you, Congressman. Once again, callers on the line, if you would like to ask a question, please press *3 to be connected to one of our team members and be able to ask a question. If you would like to subscribe to our newsletter, press *6. And if you would like to seek assistance from some of our caseworkers, please press *0. Once again, press *3 to ask a question, press *0 to seek assistance from our caseworkers, and press *6 to subscribe to our newsletter. Congressman, we also have some viewers here on Facebook and online. We're going to segue really quickly to a quick question from Facebook Live. We have a question from Lisa Giffen. Her question is, would the Medicaid shortfall be resolved if illegal immigrants were removed?
No. The short answer to your question is federal Medicaid dollars do not go toward the coverage of undocumented immigrants. Let me repeat that. Federal Medicaid dollars do not go towards the coverage of undocumented immigrants. They're not eligible to enroll in federally funded coverage that includes Medicaid or our children's health care program or Medicare. And nor are they allowed to purchase coverage through the marketplace. In January in 1st of 2024, California did expand, and states are allowed the flexibility to allow adults to qualify for full scope Medicare coverage, regardless of their immigration status. But this is not under the title of Medi-Cal. This is an offshoot, and the state does not the state implementation does not receive federal matching dollars. So it is true that immigrant status, we don't let people on the side of the road if they're ill or if they have some injury. They do get care, but oftentimes that care ends up in an emergency room where it's uncompensated, and and the hospitals in our valley end up having to take that. They got to provide the health care. They don't. We as a country, we don't allow people to just be sick, but they don't get compensated for it. That's the bottom line.
Thank you, Congressman. Our next question will be from Mariana in Visalia. Mariana, the floor is yours.
Thank you. My question falls on all the three. How much of the $880 billion is going to be cut? And from that remaining of the cut, who decides how it's spent towards Medi-Cal? And who decides which programs stay under Medi-Cal? For example, is it just pregnant women? Is it just children and adults that are on cash aid? Because they're automatically linked to the Medi-Cal program if they're cash aid eligible.
Well, that's a very good question. $880 billion is the cut that the Budget Committee has been placed there. And what they have yet to be determined is, how those dollars that have been provided to the states will enact these various programs. And we clearly would like to make our own priorities in terms of the coverage that's provided, in terms of where we think our highest priorities are. But until these cuts are enacted, we can't make that determination. But I would ask you to please continue to be in contact with our office, because we'll have a much better idea in the course of the next 4 weeks and the next 6 weeks as this reconciliation process is going through, and we're having to understand better what the Republicans' cuts are going to be in this reconciliation process that will impact the bottom line, to answer your question directly, on where current health care, access to current health care services that we provide through this safety net are most impacted. And, we have, all sorts of issues that you've raised. Inpatient hospital services, early and periodic screening and diagnostic treatment services. I mentioned earlier federally qualified health care centers, the clinics, family planning services, emergency and non-emergency medical transportation, pregnancy-related services, nursing facility care, age 21 and older. I told you that 61% of the nursing homes in the country, it's the country, right, not California, are reliant on Medicaid. And there are physician services, and then home health. We answered that earlier question about in-home supportive services. So those are traditional benefits that are part of our safety net that are the two primary benefit packages under state Medicaid programs. And so, we all have reason to be concerned.
Thank you, Congressman. Our next question is from Sandra from the city of Fresno.
Hello.
Sandra, the floor
yes.
is yours.
Yes, this is Sandra, and I'm also a tribal member, and I get services from the Fresno American Indian Health Project. Some family members go to Central Valley Indian Health Project, and I just wonder, are the Medicaid cuts going to affect Indian services, Indian health services?
Yes. We don't have specifics yet, but the Fresno American Indian Health Project receives Medicaid dollars, as does the Fresno American Indian Health Project, except Medi-Cal patients so it will be impacted. Tell me, how do you find the level of care through these services that have you yourself participated in accessing this? How do you find the level of care for you and for other family members that may?
Well, I've gotten all of my COVID vaccinations through Fresno American Indian Health Project, and my daughter gets all of her eye care through Central Valley Indian Health, as well as her dental care, and so does my grandson go there for his dental health. So they depend on it. I'm a retired teacher, so I don't, depend on it, but I appreciate the services they provide. But I also go to Tai Chi classes there, which is good for, older people for balance and so on. So,
That's good. So you're satisfied. Your children are satisfied with the care that they've been receiving.
Yes, they are, and they don't want to have it cut, and neither do I.
Well, I hear you, and that's one of the reasons we're hosting this teletown hall, because it's important for me to know that the priorities that I've tried to outline during the course of this teletown hall reflect the concerns and the needs that the people in my congressional district have.
Thank you. And, we want you to do everything you can do to stop all these, chainsaw cuts that are happening because of DOGE.
No, I would concur with you. The fella was not elected by anyone, and while I think one can say that there are merits to making surgical cuts, to use a medical term here, since we're talking about health care, can have merit, but a chainsaw is not the way to go.
Exactly. And I'm glad you also supported the April 5th demonstrations. I took part of in that as well. Good.
I'm glad that you were engaged, and they had I heard a good group of folks, about 2,000 people.
Yes, and I called the local NBC because I told them I want to see us on Rachel Maddow on Monday.
Okay, well, stay with it.
Right.
To that question that was earlier asked, what people like yourself can do to support me, those kinds of efforts are important. We need to continue to make our voices heard in many different ways, and social media is another way in which voices can be heard, and so continue to make your voice heard. It makes a difference.
Thank you. I certainly will. Thank you for taking my call.
Thank you.
Thank you. All righty, Congressman, our next question comes from Riley of Fresno.
Hello, Congressman.
Riley, the floor is yours.
Yes. Can you hear me?
Speak up a little bit, Riley, please.
Okay. All right, yeah. Can you hear me now, Congressman?
That's better, Riley.
Okay, good. Thank you. Yes, I just have one question. Early in your talk, your preliminary talk, you mentioned two other representatives in our area who have large numbers of Medi-Cal recipients. I believe one is Valadeo and one is Congressman McClintock. Can you shed any light on what you think their positions might be on the proposed cuts?
Yes, with some degree I can. The largest percentage of impacts on Medicaid is Congressman David Valadeo. He has over 507,388. As I indicated, my district is number 2 with 556,532. Adam Gray is number 3 at the congressional districts, 419,133. Vince Fong is number 4 with 260,675. And McClintock, whose district maybe you live in, has 246,709. So altogether, this totals over 1.8 million people in the San Joaquin Valley dependent on Medicaid. As I say, that's more than the population of the state of West Virginia. Congressman Valadao spoke on the House floor 2 weeks ago, indicating that while he would support a procedural vote for this, that he had the largest recipients of Medicaid in California, and that depending upon the impact on the cuts, he would reserve his vote on how he would vote on the final legislation based upon the impact of, he referred to the Medicaid cuts and the SNAP program for people that are food insecure. So I know that Representative Valadao is very concerned about this. I've not heard Tom McClintock's view. I've not heard him speak on this issue, but from other input that I've received, I don't know that this is high on his priority list. I think it's up to the voters in his congressional district to reach out to Congressman McClintock and find out where he actually ranks these cuts in Medicaid and how he intends to vote accordingly, because I certainly can't speak for him.
Great. Thank you, Congressman. Our next question comes from Jill in Fresno.
Hi, Congressman.
Hi, Jill.
I am, you're my neighbor too. I am wondering if you share my concern. And my concern is this, that if the Republican Congress is able to push through this cruel cut, this inhumane cut, that this will simply be a green light for Republicans to go on to eviscerate Medicare, which they've wanted to do since its inception, and then on to the Affordable Care Act for the rest of Americans. That's my worry. This will simply be the first step in the entire obliteration of health care in this country.
Well, Jill, I share your concern, and I think that the notion that we would not have a safety net in America for health care for those in need, I find completely untenable and unconscionable. And the voters really need to make their voices heard, and that's, I think, to your point. I think it's critical that there be a response on these Medicaid cuts and the impacts it has on health care, not only in our valley, but throughout our country. The impacts it has for health care providers, for our hospitals, for our health care clinics, for individual physicians that are taking Medicaid patients. Because this will, I think, if these are successfully implemented, I think that there's going to be a desire by many of my colleagues on the other side to go after Medicare. You're correct. Many of them have felt that, and what's so frustrating for me, and I'll close on this point, is what's the alternative that they're offering? I mean, we're not. I mentioned the unpaid health care that our hospitals and clinics provide, that they have to just figure out a way to absorb. It's undermining their financial status. But the Affordable Health Care Act, in my congressional district, before we passed that, I had 24% of my constituents who had no health care insurance whatsoever. 17% of my constituents were underinsured. We passed the Affordable Health Care Act, which we could have improved, I believe, but when we passed it, the people without health care insurance in my district went from 24% to 10%. That's a big difference. With people with no health care insurance, 24%, and over a period of a number of years, it reduced down to 10%, and the underinsured improved as well. And the expansion of the children's health care insurance, CHIP, is also critical. 60% of my constituents benefit from the children's health care insurance. Obviously, those are children that qualify under the program. But this is the critical funding for health care in America. It's our safety net. And we're not funding it right now at the level it needs to be because we have many of our health care providers that are having really significant financial problems, like the closure, as I said, of Madera Hospital. And we have other hospitals and clinics in California that are having very serious financial issues. And to take away the foundation of our safety net would put America's healthcare system in a medical crisis that we've not seen the likes of.
Thank you, Congressman. Callers, once again, we have a few more minutes left here on the call to ask some questions. We have about 8 more minutes, so if you would like to ask a question, please press *3. If we are unable to get to your question, please leave a voicemail after the event, and we will be sure to respond to you. Congressman, our next question comes from Connie of Fresno.
Hi, Congressman. Hope you're having a good day today. First I want to thank you. You really stepped up and helped my family when my father was dying. And I appreciate all the help you gave us in that situation with Medicare. I am a Medi-Cal recipient. My son is disabled. He is also. And then I have 3 grandchildren. And I'm kind of scared because what will we do without Medicaid? I mean, the kids are still going to need medical care. And I'm on Medicare and Medi-Cal, and now that you're bringing up Medicare, it's scaring me to death because we would not be able to get treatment at all without the 2. And like you said, we'd end up in an emergency room. And that's just crazy. I mean, when is this vote happening, and what can we do to support you?
Well, you're doing it in part today by participating in this telephone town hall. You do it when you send letters in to not only our office but colleagues who are similarly impacted. That's why I listed the 5 congressional seats in the Valley that total 1.8 million people who are reliant upon Medicaid. California gets $90 billion. And and to answer your question about the vote, the first vote is taking place tomorrow, but there will be a series of other votes over the course of the next month and over the next 6 weeks for them to pass this package in total that will provide sufficient funds to make permanent the tax cuts for the very wealthiest in our country and for corporations, and I just think it's a value system. And the individual who called just a moment ago about the Affordable Health Care Act, and I didn't complete my thought on that, but I should do so because if my colleagues on the other side have better ideas in terms of how to provide a safety net, I'm very interested in listening to those ideas and how we can successfully implement them. But the bottom line is, in the case of the Affordable Health Care Act, after we passed it in 2010 until 2018, the majority members voted to repeal the Affordable Health Care Act, not 10 times, not 18 times, not 34 times, not 48 times, not 60 times. Between 2010 and 2018, I voted to oppose overturning the Affordable Health Care Act that acted as a supplement to Medicaid and Medicare over 70 times. And if they had offered something to replace it with, I would have been more than willing to sit down and say, okay, maybe this is a better way to do it. This is a more efficient, cost-effective way to do it. But there was never an alternative provided. And you may remember it was one of his last acts as a member of the United States Senate. But when they were voting to overturn it, John McCain came in, at the final stages of his cancer, and walked down to the well of the United States Senate and put his hand up and put thumbs down in a no vote, which was the critical vote in the Senate to oppose overturning the Affordable Health Care Act. There are ideas about better ways people think that we might provide a safety net in America. There are efforts that we see in other of our allies in parts of Europe and Asia, how they provide health care, a safety net for their citizens. So I'm more than willing to look at different ways in which we can do it, but there is nothing being offered as an alternative. And that's, I think, the saddest part of this conversation.
Thank you, Congressman. Congressman, we have about 7 minutes left. Folks, callers, if you are unable to ask a question, we ask that you please leave a voicemail after the event is over, and we'll be happy to respond to you. Congressman, we have a question from the members of the press. This is from Tad Weber with the Fresno Bee, a question on Facebook Live. His question is, Congressman, assuming the House passes the budget with cuts, do you believe Medicaid funding could be restored in the Senate or in conference?
Well, this is a effort that is requires to be successful. The Senate, which has sent their own proposal, but it mirrors a lot of the House of Representatives proposal on how they would make these cuts. So they have been working together, the Senate Republicans along with the House Republicans, to reach an agreement on the amount of cuts that they want to provide so that they can provide the permanent extension of these tax cuts. That's the bottom line. So if it passes the House here tomorrow, it's one of several different steps that they will take in conjunction with the Senate. And the frustrating portion, again, for me, is that my Republican friends, the colleagues, have not engaged in any way to make us a part of this budget process. They want to do it on a simple partisan basis without any input from the other side. And we're going to see whether or not they are able to successfully do that in the course of the next month and the next 6 weeks. And if they are, the president, who's made his highest priority to make these tax cuts permanent, will sign the legislation because he's already indicated what his priorities are. And what our alternatives are at that time is that we're going to see health care dramatically impacted, I believe, for the majority of Americans. And how we respond at that point will be, I think, based upon voters letting their voices heard. And that is a process that will, I think, take shape over this year and into next year. That's my view if this is successful.
Thank you, Congressman. We have about 4 minutes left in this telephone town hall. Congressman, I am happy to report that we've had a total of 8,000 callers join us here in our telephone town hall. We want to thank everybody again for their comments and for asking their questions. Again, if you would like to leave a comment or a voicemail at the end of the event, please do, and we'll be sure to get back to you. You can press *0 to seek assistance from our casework team, or you could press *6 to be able to subscribe to our newsletter. And Congressman, I will yield to you for any closing remarks.
Well, thank you, Anthony, for your efforts, and I want to thank the entire staff. And please stay involved. Your comments to me today and your concerns are all valid. It's the reason that we've held this telephone town hall, because Medicaid does matter. It's America's safety net for health care. And if my colleagues, my Republican colleagues, have some better ideas on how we can provide for this safety net, I'm more than interested in sitting down and working through that. But the fact is that they have not wanted to have Democratic participation, which is unfortunate. And I think that America really wants to ensure that we have an adequate safety net. When we don't have a safety net, people get sick, people get injured, people have disabilities. It's not like they're left there unintended. We as a society want to provide health care, but then how do you absorb that, and how are those costs spread? We used to have a model where the majority of people had access to insurance, but that's changed, and healthcare providers would rely on those who had insurance to cover the uncompensated costs. That model doesn't work very well anymore, and we have a potential healthcare crisis in America that so far too many of my colleagues are ignoring, and so your involvement makes a difference. To have over 8,000 participants in my congressional district take their afternoon from 2 to 3 o'clock in the Valley to participate this afternoon is heartening to me. It tells me that a lot of folks in my district care. I know you do. I see your faces when I'm at the grocery store, when I'm in the district, which is every weekend, when I'm going to events in Tulare and Fresno counties, when I'm going to meetings, when I'm visiting the clinics and the hospitals. And, I'll just close by simply saying my mother, who some of you may have known, Lena Costa, used to say, Jim, if you don't have health, you don't have anything. And if you don't have health care, you don't have health. And that's the bottom line. We've got to work together to protect America's safety net, to ensure that all Americans have access to affordable health care. Thank you very much.
Thank you, Congressman. We hope everybody has a good evening.
Thank you.